Hey guys, what's going on? Welcome to another video on my channel Hairliciously. If you guys are new, please make sure to hit that subscribe button to stay updated on hair transplants and hair loss topics. Visit my website at hairliciously.com to purchase your microneedling devices, which are scientifically proven to stimulate hair growth. My low-level laser therapy cap, hair growth vitamins, DHT blocking shampoo and serum, and a few other products for those who are suffering from hair loss. So one of the most commonly talked about topics on my channel Hairliciously pertains to microneedling and dermal rolling. It seems like there's been a growing interest in people who are looking into incorporating microneedling into their hair loss treatment regimen, not only because it works, but also due to the fact that micro-wounding the scalp is a relatively safe procedure compared to other hair loss treatments like finasteride or dutasteride or other antigens, which can, obviously come with unwanted side effects. There's been a lot of people who have also seen incredible results from microneedling, and I've covered a lot of these videos on this topic with before and after photos that I found from various hair loss forums and Reddit posts. The majority of people who have incorporated microneedling into their hair loss treatment has attributed to increased density and hair growth. And over the years, there's been multiple studies that show and confirm the efficacy of microneedling. So if you are new to this, I think it's really worth a shot because it's known to stimulate growth factors and promote hair follicle proliferation. And more importantly, it works in a different mechanism of action to promote hair growth compared to other treatments like finasteride or minoxidil. So by targeting hair loss through various mechanisms of action, you're more likely to also see better increase in overall improvement to your hair and also to hair count. So just to kind of go over a few studies and show you the efficacy of microneedling, a study from 2017 showed that microneedling as monotherapy showed hair count improvements by about 15%. This was solely done without any other forms of topicals or oral medication. Another study from 2013 showed that microneedling enhanced regrowth achieved from 5% minoxidil by about 400%. And finally, the more popular study from Dr. Durat in 2015 showed that incorporating microneedling with 5% minoxidil twice a day showed significant increase in hair count. And a lot of the microneedling protocols that we now see nowadays that we actually use mimic the same methods that were used in this study. So these three studies were conducted using a microneedling device between needle length of 1.5 and 2.5 millimeters. And then a fourth study that was conducted in China in 2020 was using a 0.6 and 1.2 millimeter needle length. And then you have people on hair loss forums, on Reddit, and just all over the place who claim to be using various needle sizes, 0.25, 1 millimeter, 1.75, 2 millimeters. So overall, these studies do confirm that microneedling is indeed effective in stimulating growth. But then the question of figuring out what exactly the best needle length should be is still in question because it kind of seems like it's all over the place. There really has not been a clear-cut answer to this. And so a lot of you guys have been asking me to figure out exactly what is the best needle length. And so I'm just going to go more into detail on this topic, and hopefully towards the end of this video, you guys are going to have a better understanding of what needle length works the best and why that certain needle length is going to work best in stimulating hair growth. The truth is that different needle lengths produce different puncture depths in the scalp, which in turn is going to produce different effects on the hair follicles. It's obvious to know that the smaller the needle length, the quicker the scalp is going to heal, which means that your frequency for microneedling can increase. Whereas if you guys were using a longer needle, it's going to take longer to heal, and therefore limiting the frequency is recommended to allow adequate wound healing. So I think it's first important to really understand the anatomy of the skin on the scalp to fully comprehend how the different needle lengths of microneedling affect hair growth. So scalp skin has three main layers: the epidermis, the dermis, and the hypodermis. In general, the average scalp thickness is about 5 to 6 millimeters, and this is also dependent on our genetics, our ethnicity, degree of baldness, because if you are in a more advanced stage of hair loss, fibrosis on the scalp can thicken the scalp skin layer, and things like gender, your age, and even scalp conditions can all influence the specific thickness of our scalp. But generally speaking, we're working with about 5 to 6 millimeters for all three layers of the skin. The epidermis, which is commonly known as the top layer of the skin on the scalp, is usually about 0.5 millimeters, while the dermis, which is the middle layer, is about 1 to 2 millimeters. And then lastly, the hypodermis is around 3 millimeters thick. Knowing the exact thickness has significant relevance to microneedling because the depths of the needles that penetrate the scalp is going to have a direct influence on which regions of the hair follicles that it is stimulating. For example, if you're microneedling at 0.25 millimeters, that's only going to target the epidermis, which is good for topical absorption for things like minoxidil or topical finasteride or whatever topical that you're using. But it does does not penetrate the dermis, which is required to evoke growth factors that are necessary to promote hair proliferation. If you're microneedling somewhere between a 1.5 to 2.5 millimeter, this is where actually the growth factors for hair stimulation is located. The needle length and the depth has to penetrate the dermis of the scalp because this is exactly where the hair follicle stem cell bulge is located. The hair follicle stem cell bulge is located near the sebaceous gland in the dermis, and this is exactly where the stem cells regenerate the hair. So you can kind of think of the hair follicle stem cell bulge as a reservoir of hair follicle stem cells. And interestingly enough, when it comes to microneedling, we can actually stimulate these stem cells by wounding, which in turn stimulates the growth factors to signal hair follicle stem cells to initiate a new anagen phase of the hair cycle. As I mentioned previously in the studies on microneedling, patients who typically microneedle at a length of at least 1.5 millimeters are able to see increases in hair count since it theoretically reaches and stimulates the hair follicle stem cell bulge. This can obviously be seen in the Durat study where 1.5 millimeter was used once a week in conjunction with 5% minoxidil. And surprisingly enough, there was an increase in hair count by nearly a 400% increase. The other 2015 study was also using a 1.5 millimeter dermal roller once or twice a week and saw an increase in hair counts as well. And lastly, the 2017 study was also using 5% minoxidil with 1.5 millimeter to 2.5 millimeter automated microneedling device once every 2 weeks and also saw hair counts that were comparable to that of Dr. Durat's study. However, the more recent study from 2020 in China, where the patients were actually using 5% minoxidil twice a day and microneedling once every 2 weeks using either a 0.6 millimeter or 1.2 millimeter, found that microneedling with either length was more effective than 5% minoxidil by itself. In terms of statistical significance, the study showed that there was really not much difference between the two lengths in respect to improved hair counts. So much of the current research that we see still pinpoints to using a needle length of at least 1.5 millimeters to penetrate the dermis to stimulate the hair follicle stem cell bulge. It's clinically proven, from studies that the best range would be somewhere between 1.5 and 2.5 millimeters as it both increases topical absorption and hair follicle proliferation. Although I don't recommend personally using minoxidil right after, as it can easily go systemic and then cause unwanted side effects. But with that said, if you're not experiencing side effects, you're likely to get theoretically better results if you apply minoxidil right after microneedling, since it does help with absorption. And as far as frequency, I would still recommend using it once a week, although a longer needle length in excess of 1.5 can be conducted once every 2 weeks, which was the case for the 2.5 millimeter needle length. And as far as a lower needle length, I'm not discounting the fact that it isn't beneficial in stimulating hair growth, because I've seen people who were just using a 1 millimeter or even 0.5 millimeter dermal rollers or microneedling devices and have seen some pretty good results. So I'm not saying that a lower needle length is ineffective. It's just that most studies that we see show best results at a minimum of 1.5 millimeters. And understanding where the bulge is located in the dermis substantiates even further the need to use a longer needle length to help penetrate to the right depth. The other aspect that I wanted to kind of address was the pressure that was applied. This is also a very well talked about topic, because oftentimes people who are microneedling aren't exactly sure what pressures to use. The 2020 study that was using the 0.6 and 1.2 millimeter needles were actually trying to evoke bleeding. Whereas the other studies, Durat and then the other, that were using 1.5, we're just trying to achieve erythema or redness. So it's highly possible that while both studies were using different needles, they may have achieved similar penetration depths due to the differences in pressure. Evoking bleeding obviously uses more pressure, especially when used at a lower needle length. So ultimately, I think sticking with a 1.5 with just moderate pressure to stimulate redness, and even at 1.5, there are people who still notice pinpoint bleeding and others that don't bleed at all. It just depends on how thick your scalp is. When I personally microneedle, most of it is just erythema, the areas that I apply microneedling, but I do get some pinpoint bleeding here and there. So I would recommend, first of all, to stick with at least a 1.5 millimeter and then try to achieve redness with moderate pressure. If you're not noticing any results after a few months, I would try applying more pressure to increase the needle depth penetration. And as long as you're under 2.5 millimeters, you'll still be in the dermis layer of the skin, targeting the hair follicle stem cell bulge. The thickness of our scalps, like I said, are all different. So you may have to do some experiments and see what works works best for you in terms of needle length and pressure. And before, I've seen a few people who are actually using 2.5 millimeters, and I honestly thought, that this was crazy because even 1.5 was considered to be, at least for me, a long needle length. But to use something as high as 2.5 was just crazy. And, at least at that time. But if you actually think about it, it really isn't, because it's still within the range for the dermis, and people who actually microneedle still have seen some decent regrowth at 2.5 millimeters. And to be sure that you're targeting the stem cells in dermis, you can potentially go as high as 2.5 and microneedle the crap out of your scalp. But to be honest, I think, in my opinion, it may be a little bit more excessive, and anywhere between 1.5 and 2 should be adequate for most people to target these stem cells. I will also add that not everybody is going to be a good responder to microneedling, just like how there are people who do not respond to, finasteride or Minoxidil or other treatments. It just means that you have to find a different treatment that works best for you, whether it be through, 5-alpha reductase inhibitors, anti-androgens, whatever it may be. And the beauty of stacking on these various treatments, finasteride, minoxidil, laser therapy, microneedling, anti-androgens, is that you're targeting hair loss through various, different mechanisms of action to fortify and promote as much hair growth as possible than if you were just using, monotherapy. So keep that in mind, and also you have to be consistent with treatment. I would definitely try microneedling for at least 6 months until you call it quits, because some may respond a lot quicker to treatment, while others can take upwards to 6, 7, 8, even a whole year before seeing any results. And lastly, I would highly recommend using a motorized microneedling device over a dermal roller, only because a motorized device is more consistent with wounding, and it actually produces far less trauma, just solely based on physics and just the way that it operates. Whereas a dermal roller rolls at an acute angle against the scalp, and it causes additional trauma to the epidermis, which can result in more downtime. Well, that's pretty much all I have on this topic. Hope it clarifies some questions that you guys might have had about microneedling and needle length. If you want to share your before and after photos with me, you can shoot me an email at hairliciously@gmail.com, and I can feature your results in my next video series on microneedling before and after results. Let me know if you have any questions. Thanks for watching, guys, and I'll talk to you guys in my next video. Take care.